Hello guys, greetings and welcome to Chami Bless page. Today it's really nice to have you guys in my page. Please, as you just passing through, I plead with you to listen and also please subscribe to my YouTube page. Please, I need help. I'm just starting on this page. I really need your help and support. So today we'll be taking on hepatitis. What is hepatitis? Hepatitis can be defined as a medical condition characterized by inflammation of the liver. So it's a medical condition that is characterized by inflammation of the liver. So there are some factors that can predispose one to this condition. It could be as a result of viral infection, it could be as a result of bacterial infection, it could be as a result of autoimmune, it can be as a result of toxins. That's why we have viral hepatitis, non-viral hepatitis, and other types of hepatitis. Now, hepatitis, when you talk of the viral hepatitis, we have the hepatitis A, hepatitis B, hepatitis C, D, and E. So these five I just listed are the five major types of hepatitis. So in this viral hepatitis, we have the five major types of hepatitis. Under hepatitis A, we have hepatitis A and E. Okay, we have hepatitis A, B, C, D, E. These are the five major types of viral hepatitis, and we have A and E is the one that occurs as a result of eating contaminated food. When you eat contaminated food, when you eat food that are not well preserved, when you eat in an unkept environment, when you eat food that is contaminated, can predispose you to hepatitis A and E. Then we have vitamin B and C, which occurs as a result of exposure to some habits like it occurs as a result of contact with fluid, blood, semen, sexual intercourse, can predispose you to this hepatitis A and B and E, B and C, sorry. So exposure to this lifestyle can predispose you to this hepatitis I just mentioned now. So we also have the hepatitis D, which occurs as a result of having hepatitis B. So when you have hepatitis B, it can predispose you to hepatitis D, which is known as the beta hepatitis. And also we have the non-viral hepatitis, which is the one that occurs as a result of as a result of medications, as a result of medication, toxins, autoimmune, genetic disorder, medications like acetaminophen. You understand? Some medications can predispose you to this condition. We have some toxins, that can predispose you to this non-viral hepatitis. We have alcohol. Excessive alcohol consumption can predispose you to this condition. Genetic disorders, all these can predispose you to this condition. Then also we have other causes. Remember we said we have the viral, non-viral, and then the other causes of hepatitis. The other causes of hepatitis could be as a result of parasites like malaria parasites. When malaria is in your bloodstream for a very long time, if kept untreated, it can affect your liver. So it's wise for you to treat malaria when you suspect such condition on your body. So malaria parasites, that's some parasite like malaria parasite can predispose you. Fungal infections such as this helicobacterium, that's malaria. Can infect you. Exposure to radiation can also predispose you to this condition. Then what again? Bacterial infections, all these can predispose you to this condition. So we also have the risk factors. Risk factors are those that are highly at risk of contacting this condition. We have as those at higher age. You have age as a factor, which affects those at younger age. You have the younger ones and those that are elderly ones. We have also poor hygiene can also predispose you to this condition. We also have unprotected sex, which can predispose you to hepatitis C and B. You understand? And remember, when you have hepatitis B, it can predispose you to hepatitis D. And we also have poor hygiene. Poor hygiene, when you eat food that is not well preserved, that is not well kept, it can lead you to hepatitis A and hepatitis E. And you know that any of all these hepatitis can also lead to damage to the kidney, damage to the liver. So that's why you should be observant to all these things. Also, people that are at risk of this condition is the health workers, those that are handling blood, those that are exposed to people that is suffering this condition, you understand, are also at risk. That's the health workers, the nurses, the doctors, because they are handling this condition. Those that are handling needles, you understand, because they might want to give injection to these people, and unfortunately for them, they get a needle prick. They can contact this, especially hepatitis B and C can be contacted through this condition. Then we also have yeah, we've talked about health workers and so on, yeah, and so on. So you can Google to find out others that are at risk of contracting this condition. So how do you know now that you're suffering from this condition? There are certain signs that when you see it in your body, you suspect that you have gotten this condition, one of which is fatigue. You feel tiredness, you feel loss of appetite, you feel so tired, you feel loss of appetite, you feel nausea and vomiting, abdominal pain. Then there is dark urine, your urine will be dark. Then your stool will be kind of clay in color, and also you will start manifesting with yellow coloration of the eyes, yeah, which is known as what's it even called? Which is known as jaundice. Yellow coloration of the eyes is known as jaundice. So the person will start manifesting with all these conditions. You mustn't dictate all these conditions, all these signs at once. You might dictate few of it. You might dictate discoloration in the eye, that's yellowish discoloration of the eye. You might have pain in the abdomen, severe pain in the abdomen. You might have urine, that's the color of urine will change, all these kind of things. There are some things that you will notice. You might be feeling weak, you will lose appetite, you will not have discoloration in the eye. You might have three signs. It mustn't be all the signs that you present before you start going to hospital to check the for go for investigation to find out what is wrong with you, you understand? So in the treatment, we have the medical treatment and the preventive treatment. So one of no we have the treatment. In treatment now of this thing is the use of antiviral medications. Antiviral medications to to are used in treatment of this condition. We have the infrared therapy. This is used. We have the liver transplant, which is done in severe cases when the condition is so bad, that the liver has been severely damaged. This is where this liver transplant is done. We also have the other supportive care like getting rest, taking enough fluid, dehydration, eating good food. It's a kind of supportive care. It will help you to pull through the condition. You understand? Maintaining a healthy lifestyle also help you in this condition. We also have the preventive treatment, which is getting your hepatitis B vaccine when due. Like in Nigeria, we do it when a child is born. Immediately a child is born, yeah, a child is given during pregnancy. You take the hepatitis B immunization. You make sure you take it, complete the dosage. Then when a child is born, you also make sure you give the child that immunization. It will help. Then you practice safe sex. You know, mm, using protective measures where need be. Avoid sharing of needles, can also help you in this condition. Another one is avoid eating contaminated food, to prevent other types of hepatitis. Maintaining a healthy lifestyle, practice good hygiene, all these kind of things. Avoiding sharing of you know of needle in the hospital and stuff like that. All this can help you to to prevent the occurrence of this condition. So another one here is looking at the diagnosis, the test investigations that we'll do in order to find out if we are suffering from this. So one of which is the serology review, in which the hepatitis B antigen appears like 1 to 2 weeks after it's in your body. It can read positive in the serology test. Then in hepatitis B antigen test, you can also use it to find out if you're suffering from those conditions. Then we have the complications of this condition. We have the chronic liver disease. It can lead to chronic liver disease. Then we can lead to liver cirrhosis. It can lead to liver cancer. It can lead to kidney damage. It can increase the risk of infections. So these are the major complications that can arise as a result of hepatitis. Remember, we said liver cirrhosis, kidney disease, can lead to cancer. It can lead to other infections. You understand? So try to keep yourself updated, take good care of yourself, prevent or avoid some funny activities, sexual activities, avoid it where need be, use protections where need be, take good care of yourself, maintain good hygiene, live a healthy lifestyle. And once you practice all these things and visit your physicians, go for checkup, to find out how your body is doing. With all this, you will see that you will live a good life. Thank you so much for listening to me, and please, I'll appreciate it if you help me to click on the subscription button so that you will be able to get more be informed when I give more health related teachings. Please, I really appreciate your presence. Thank you for listening and remain blessed. Thank you so much. See you.